Welcome to The Explainer. If you're a nursing student, you're in exactly the right place. Today, we're breaking down asepsis. This is the critical, non-negotiable skill you absolutely need to master to keep your patients safe. Let's get right into it.
Let's start with this idea right here, because it's so powerful. Your hands, your technique, your knowledge. All of it comes together to form a shield protecting your patients from this invisible world of microbes. You really are the first and, honestly, the most important line of defense.
So here's our game plan for this explainer. We'll start with breaking the chain of infection, then really master hand hygiene, compare the two big techniques, medical and surgical, cover sterilization, and then wrap up with some key things you'll see in the clinic.
Okay, first up, breaking the chain. Look, to really get the how of asepsis, you have to understand the why. So let's look at the fundamental goal behind every single action you're going to take.
This is so important to get right from the start. Asepsis isn't just cleaning. It's a whole set of deliberate, intentional actions designed to interrupt that chain of infection. It's an active process, not a passive one.
All right, now let's focus on the single most powerful tool in your entire arsenal, hand hygiene. I mean it. If you get this one thing right, you are already winning the battle against infection.
As you can see, not all hand hygiene is created equal. Knowing when to wash versus when to sanitize is absolutely critical. Soap and water are for physically removing gunk and certain microbes, while sanitizer is a killer. It kills the germs on contact. This distinction? Oh yeah, it's a classic exam topic, so definitely pay close attention here.
Now, let's break down the actual technique. It might seem basic, but trust me, every single step is vital. You need that friction, you've got to cover every surface, we're talking between the fingers, under the nails, the backs of your hands, and the time is totally non-negotiable.
All right, pop quiz time. This exact question, or some version of it, is almost guaranteed to pop up on your exams. So, what's the magic number?
That's it, 15 to 30 seconds. Hey, don't laugh at the happy birthday trick. It's not just for kids. It's a proven, super simple way for all of us in healthcare to make sure we're scrubbing long enough to actually be effective. Seriously, it works, so use it.
And the technique for sanitizer is just as important. It is not enough to just slap it on and wave your hands around. You have to use enough of it and rub and rub and rub until your hands are completely dry. That's the only way you know the alcohol has had time to do its job.
Okay, everybody, lean in. Pay close attention to this because it is a major patient safety point. Alcohol sanitizers will not, I repeat, will not kill C. diff spores. So after caring for a patient with C. diff, you must use soap and water. There are absolutely no exceptions.
Okay, deep breath. We've mastered the building block of hand hygiene. Now, let's level up. We're going to look at the two big picture principles, or mindsets, really, that will guide your practice: medical and surgical asepsis.
So first up is medical asepsis. You'll also hear it called the clean technique. Think of this as your daily driver, your default mode. It's all about reducing the number of microbes and stopping them from spreading. Hand washing, wearing gloves, cleaning equipment, that's all medical asepsis.
But then, you have surgical asepsis, or sterile technique. This is a whole other level. Here, the goal isn't just to reduce microbes, it's to completely eliminate them, all of them. We're creating an environment that is totally free of microorganisms. This is non-negotiable for any invasive procedure.
Seriously, you might want to screenshot this slide. This table is your perfect study guide for this topic. It breaks down the key differences in a really clear way. Look at the goal, the hand hygiene, the environment. Understanding these distinctions is just fundamental to safe nursing practice. So that begs the question, right? How do we actually achieve these states of clean or sterile? Well, that brings us to our ultimate weapons in the infection control fight: sterilization and disinfection.
Here's another classic NCLEX-style question that loves to trip students up. The words sound similar, but in our world, in healthcare, their meanings are miles apart. So what is the key difference?
And here is the answer. The key word for sterilization is all. It kills everything. I mean everything, including those super tough bacterial spores. When an instrument is sterilized, it is completely 100% free of living organisms. This is the gold standard for surgical tools. Disinfection, on the other hand, it's more of a spectrum. You've got high-level disinfection, which gets rid of almost everything but might leave a few spores behind. And then there's low-level, which is for general surfaces, like a bedside table.
It reduces the number of germs, but it doesn't eliminate them all.
Okay, when you're preparing a sterile field, I want you to burn this number into your brain, 1 inch. The outer 1-inch border of any sterile drape or package is always, always, always considered contaminated. Never, ever place sterile items there.
The sequence for opening a sterile package isn't just some random dance you have to learn. It's a carefully designed procedure. Think about it. You open the flap furthest from you first so you don't have to lean over the sterile field and contaminate it with your uniform. Follow these steps exactly, every single time.
All right, let's bring it all together. How does all of this actually apply to you when you're out there in clinicals? Let's cover some really key real-world considerations.
And this right here, this is where it gets personal. Your own grooming is a patient safety issue. These are not just arbitrary school rules. There is research that proves things like chipped polish, gel nails, and even rings create these perfect little hiding places for bacteria that even really good hand hygiene can miss. Your hands are your most important tools. You have to keep them safe.
So remember, mastering asepsis makes you a guardian of patient safety. It's truly one of your most important responsibilities as a nurse. If this explainer helped you feel more confident, please do us a huge favor and like, share, and subscribe for more content to help you crush it in nursing school.